Here's 4 reasons why it's possible to help heal bone-on-bone knee arthritis. The first reason is that knee arthritis on an x-ray does not equal pain. Now, there's tons of studies, here's one of them right here, that show that if you have an x-ray that has knee arthritis on it, that's your knee, it doesn't mean that you're going to always have pain. They've shown that there's so many inconsistencies. There's people that have really bad looking x-rays on their knees, yet they feel fine. And then the other way around, where there's people that have a lot of knee pain, but their x-rays look great. Now, there's certainly people that have bad looking x-rays and bad knee pain, and there's people that have great looking x-rays and have zero knee pain. But what we found out in the research over the past couple of decades is that it doesn't always connect. It doesn't always correlate, that the worse your x-ray looks, the worse your knee is going to be, which I think is excellent news, because if you've been told that you have bone-on-bone knee arthritis and you hurt right now and you had the x-ray, you're in that category where bad x-ray, bad knee pain, you can convert into a person that still has a bad x-ray but feels fantastic. So it's completely possible to be there. And more importantly, we see it happen all the time. I've been doing this for over a decade, helping people with bone-on-bone knee arthritis get back to walking as long as they want, going up and down stairs, even going into the gym and doing exercises, including cardio exercises and weightlifting with their legs, like doing squats and deadlifts, those kinds of things. If you choose to, we can help you get there. But even with a bone-on-bone knee diagnosis, you can do that. Number 2 is that the term bone-on-bone is more and more becoming a misconception. And they're finding this out in the research. What they're researching currently is that if a medical professional, a doctor, tells you you have bone-on-bone knee arthritis, psychologically the effects are greater than the physiological effects. Let me say that differently. It does more for your psyche than it is actually doing inside your knee joint. And what it leads people to do is to think that they can't do anything, that they shouldn't be exercising, that they shouldn't be walking, that they shouldn't be doing things because they're going to make their knees worse. Because if the joint is bone on bone, they're just going to be grinding away at the joint and wearing it down to a nub. And you're gonna not have any cartilage left whatsoever, and you're just gonna expedite the process for you having a knee replacement someday. But this is so far from the truth, because like I said a second ago, it's completely possible to get back to being very active, even if you've been told you have bone-on-bone knee arthritis. But a problem that I'm having to undo with many of my clients is getting them to have the belief that they can do it, because they're so self-limited in their belief about how bone-on-bone arthritis works. And doctors, surgeons these days don't take the time to explain it. Maybe the newer ones are, but it's been my experience that most patients that I see haven't been explained the intricacies of the psychological effect of bone-on-bone knee arthritis, of when they tell them that. And so it very often feels like we have to just undo all that mental stuff that people put themselves through. But if you can bring yourself to believe that it's possible to do a lot, even if you've been told you have bone-on-bone knee arthritis, then you've won half the battle. I'd say more than half the battle, because now you're gonna be more likely to do exercise. You're gonna be more likely to try things that can help you out. You're gonna be not afraid to go on a walk, even though your knee doesn't hurt. Like, that's something that a lot of people do. Even though they don't have pain, they have a good day, they still choose not to do activity because they're afraid it's going to get worse, when in reality you need to do the activity. There's so much research showing that people who are more active, generally speaking, tend to feel a lot better even though they've been diagnosed with knee osteoarthritis. Okay, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it, and it doesn't matter how severe it is. If you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too. And of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program. And I hope to see you in the program on our coaching calls. Number 3 is cartilage healing science is so behind. We're in the Stone Age when it comes to this stuff. And really they're working with their hands tied behind their back. Because in real life, inside your knee joint, studying how cartilage heals is so difficult on a live person. And if you were to take tissue samples out of your cartilage, it would be so unethical because they'd be removing cartilage, and you need all the cartilage you can to be successful in being active again without having surgery. And removing the cartilage would require surgery anyway. It's a minor surgery relatively, but it would be throwing everything off. And so what's missing here is the pressures that are in the joint. It's something that's not studied at all. I'll talk about that more in the 4th reason, but just to harp on the cartilage just a bit more, when you get the x-ray from the doctor of your knee and they tell you that it's bone on bone, they're comparing it to what a normal knee x-ray looks like this one. And there's lots of space in the middle of the joint between the thigh bone and the shin bone. Those are called the femur and the tibia. But your x-ray probably looks more something like this, where the space is gone and the doctor is assuming that your cartilage is gone too because the bones are closer together. The thigh bone and the shin bone are now almost touching. Now, here's the problem with this x-ray. They didn't actually look inside your joint. They used x-rays to look inside your joint. So they didn't actually see what the cartilage looks like inside your joint. They're just assuming that there's a loss of cartilage. In reality, if you have cartilage still, it's possible to squash it, which means it's also possible to take pressure off and unsquash it and give the joint room again. The criteria or the factors that I talk to with our clients is if you've had an x-ray that's shown a bone-on-bone situation, like this x-ray that I showed you, but your motion is decent, it's pretty good actually, maybe even completely there, you don't have any limitations in motion, then there's high potential for you to heal just fine, even though you had that bad x-ray, because your cartilage is still working, your joint is still operating. If you can bend your knee through full range of motion, and it might hurt, your knee might be swollen, it might feel uncomfortable, but if you have like 90% or better motion in that knee joint, then I would disregard the x-ray at this point. I mean, obviously you took it into account. You know you got an issue, it hurts. That's why you went to the doctor to begin with. But don't let it be a factor that's stopping you from doing things. Don't let the image of the knee that looks like this live in your head, with the redness and the cartilage being gone and torn away, or like this where there's nothing. Because in reality, if you have a loss of cartilage, you're gonna have a little tiny dot that you still have a ton of good cartilage around it, and you can function just well. You can function just fine without a little spot of cartilage missing. You're still gonna have tons of range of motion, which gives you the ability to still do a lot. So now I'm gonna go to the 4th reason here, and it's that muscle imbalances have not been thoroughly researched or researched at all. I've looked, and the idea of muscle imbalances, people talk about them, but they don't really understand them. They talk about it as if it's some obvious thing that everybody knows about and is working on and just includes in treatments and knows, but nobody really knows about it. And the way that I explain it here, pay attention, because this is really important to know how to offload that knee joint and heal a bone-on-bone situation. In the knee here, you have muscles all around the knee. The front of the thigh here has quad muscles, quadricep muscles. They connect to the kneecap here, and then there's a ligament or a tendon that runs down from the end of the kneecap to the shin bone, and those quad muscles have the ability to contract. When they do, it straightens out your knee. It also pulls the shin bone into the thigh bone. So it adds pressure to the joint, to the cartilage. And it has the ability to close that space in there if it's strong enough and working hard enough, and if it's been squashing that cartilage for long enough. You're going to get a decreased joint space. But if you can get these quad muscles to not be so overactive, not dominate all your activities, then you can set up the situation where you decrease the pressures in the joint and restore the space inside the joint and allow your cartilage to rehydrate, gain its normal size back, and work properly for you. And the way to do that is by taking the workload off this muscle. Usually we focus on glutes muscles. Very often in people that have knee arthritis, let me take that statement back. Always, I've yet to find a patient that hasn't had this. A patient that with knee arthritis. People don't have good glute strength. Always. They can't even fire their glute muscles often. Sometimes they can, often they can't, and that's a massive sign that you're going to be using your quad muscles much more. So if you don't have good glute activation or none at all, then you're going to be compensating with the quad muscles and possibly even the hamstrings. Most often it's the quads, and then these muscles in the thigh, whether it's the hamstrings or the quads, they attach down to the shin bone and pull it up into the thigh bone, which closes the space and can give the image on an x-ray of a bone-on-bone knee joint. So if you can fix the muscle imbalance, then you have a shot at fixing your bone-on-bone knee arthritis. I talk all about how to fix the muscle imbalance all throughout my channel here, but you want to check out this video next if you want to learn how to fix the muscle imbalance so that you can help your bone-on-bone knee arthritis. It's a whole process. There isn't a magic exercise. You have to do some work and some learning, more importantly, so that you can fix this for the long term.